And the way it works, so it's a predictive search. So if we search for Ramapril, and it'll auto-complete, and then you can search here, and it'll take you through to the page specifically for a drug. So you'll always have the name of the drug at the top. If you want to search for a different drug, there's the search for a different drug button here, which just takes you back to the previous search page. As soon as you come through, you'll be taken through to what we call the monitoring parameters. So these are the actual specific things you monitor, like blood pressure, the electrolytes, the renal panel. And so you'll have a count of how many there are for each one. And then when you click on these, you'll see you get a drop down, which I'll go through in a second. So each one will have a drop down, which is collapsible and not uncollapsible at your leisure. So once you click on each parameter, here you can see what route it's for. If it was for more than oral, if this information was relevant to IV as well, that would also appear there as IV. Otherwise, there'd be a separate icon for blood pressure IV if it was different. For this drug, Ramapril, we've just covered the oral route to begin with. So as you can see, for each parameter, so blood pressure in this instance, on the left-hand side, you have the before starting treatment. So this is kind of baseline sort of things. And so you'll just have a yes if you do it before, and then what action to take if anything comes back abnormal. On the right side, you have everything that happens from the point the patient starts taking the drug. You can see this one's quite a good example because it's split into two different indications. We've got heart failure and hypertension. So depending on what you're using Ramapril for in the patients, the monitoring advice might differ. And so that's why we've got indication specificity here. Then we also have a special circumstances section. This is generally for special populations. So it might be like, this is the general information for heart failure, but in at-risk groups, which are shown down here in the further information. So in these groups, you might monitor a bit more frequently than you would in your average patient. And then again, the action to take on this side for if anything comes back abnormal with the blood pressure. As you can see, we have evidence grading on anything that's an action. So if you hover over them, you can see manufacturer information is the M, strength of recommendation I's, because A is the same as it would be for BNF and other products with evidence grading. Then we have a rationale section for each parameter. So under blood pressure here, you can see that the reason why you monitor blood pressure with Ramapril is to monitor efficacy, basically how well it's working. And also Ramapril can cause hypotension.